Well, I think we'll go ahead and get started. So welcome everyone. I'm Ginger Bandine. I'm the founder and CEO at Mission Driven Data. I'm joined today by Crystal Vega, who is our implementation consultant here at Mission Driven Data. We are so excited to see all of you here. We are so excited to be talking about whole person outcomes. We always like to know where you're joining us from. So if you've just got here, please hop over to the chat and say hello and let us know where you're at in the world. It's always just really nice to know who's here. And we have a big turnout today, which is amazing and awesome and very exciting. Hi, Pam. Hi, Nicole. You guys are all amazing. Hi, Chris. So I'm Ginger Bandine. I'm the founder and CEO of Mission Driven Data. I'm a social worker by background, and I thought I would say a little bit more about myself since today we're talking about something that's so dear to my heart. I started off doing I started off knowing I wanted to be a social worker when I was in junior high and ended up going to college. I grew up out here in Oregon in a small town, went to college on the East Coast, took social work classes, went through and got my master's degree. And then my first social work job was in New York City, working with folks at a drop-in center for people who were homeless near the Staten Island Ferry Terminal. And from there, I learned a lot about people and the trauma people go through and the resilience people have and the amazing social connections people build in very extreme circumstances. And I really loved that work. And it was a great way to get to know the field of social work from a great perspective where it was very hands-on and helping people who were maybe going through some of the roughest part of their life. From there, I ended up coming back to Oregon and I've done various roles, like some more administrative, but still some clinical roles where I did in-person intensive case management in another rural setting where I got to visit people in their homes who would have otherwise been in the state hospital and help them figure out how to have a life they liked in their homes instead of ending up having an acute mental health issue that meant they had to be hospitalized. And so over time, I started doing more quality improvement and compliance stuff, which led me to understanding electronic health records and data. And through that whole time, I've always tried to keep in mind the folks I used to serve, both in New York and in the rural town where I did direct practice. And I think a lot about community agencies and the value that people who are doing those jobs now bring to the communities and the people they serve. And I think a lot about how the data that we are tracking doesn't always reflect the amazing work that is being done and the amazing progress people are making. And so a lot of what we're talking about today is this culmination of us working really hard as a team to figure out how we can do that more and better and more effectively. So that's why I'm so excited about this today. I literally, when we talk about this picture, the client I used to visit who was living in a trailer on her family's property, who over time would manage to clean the trailer up, have food coming in that was fresh, and have a life that she felt really good about and make new friends. So I think about that kind of person all the time. So that's why I'm here, and that's why I'm excited to talk to you guys today. Crystal, do you want to introduce yourself and say a little bit about why you're here?
Yeah, so I'm Crystal. I'm just a few months away from my MSW. I have experience with like project management, community engagement, behavioral health access. I used to work in higher education too, so I've done a bunch of different stuff, helping students get with serving their basic needs, a lot of cultural sustainability, and what does it mean to feel like you belong, and what is well-being is definitely I have a lot of experience with. Like, it's more than just medical, like, are you physically healthy? It is also about like the social connection part and just feeling like you matter to someone. So yeah, that's why I'm here, and I'm just all about getting things done and moving the needle too. So I'm really excited that I got to be a part of this.
Great. Thanks, Crystal. So most of the folks who are here already know a little bit about Mission Driven Data. We offer a software product that works with the credible electronic health record called Janet. We have this community where we host events like today, and also lots of guest speakers and other trainings and things like that. And then we offer professional consulting. So that's a little bit about us. You're in the right place if you are interested in new ways of thinking about outcomes and treatment success. If this is something you've given some thought to, or you wish you had time to give some thought to it, but you haven't had a chance, today is a chance to stop and think a little bit about that stuff. So we're really happy to have you here. You're also in the right place if you would love to see an outcome measure that captures the benefits people receive from your services, maybe a little bit more effectively than the things you're using now. And you're also in the right place if you're looking for methods that will deepen your understanding of clients' well-being. So we are excited so many of you chose to join us today because it actually warms my heart that so many people are thinking about this and excited. So thank you for being here. Our agenda today is we're going to talk about where we are when it comes to outcome measurement in our field. And then how do we transform that way of thinking about outcomes and measurement? And then we're going to talk about the WHO-5 Wellbeing Index and whole person outcomes, which is this new feature of Janet that we are so excited to tell you about. Just a few housekeeping things. We're recording today's session so you can relax and just absorb information and maybe process it a little bit. Please ask questions as we go. I'll be keeping an eye on the chat, and so will the rest of our team. We're also going to email a handout to you after the session, so don't worry, you'll have some information there too. And everyone who's here is very welcome to book some time to chat with me and Crystal about whole person outcomes. This is something we've spent a lot of time thinking about. And if you're just curious or you'd like to brainstorm or you have some ideas you want to share with us, we'll have a link to our calendar available at the end of the session. I'm making eye contact with someone on my team who will get that ready for us so that you can book a meeting with us and chat more about it. So we always like to kick things off with a poll, but you might recognize this from a pop culture reference. You may have seen that the most exciting thing happening, let's hope it was the most exciting thing happening on Twitter lately, was that Elmo posted from his account that he said, Elmo is just checking in, how is everybody doing? And turns out lots of people responded to that post, and lots of people weren't doing very well and chose to respond to that with a real answer to that question. So what we wanted to do today was, for our first poll, we wanted to see if you felt brave and wanted to fill out the WHO-5 Wellbeing Index yourself. So you should be seeing that on your screen. The WHO-5 Wellbeing Index, we're going to talk more about this, but it's really just a measure of overall, how are you doing? So we won't share these results. We're not going to analyze you and try to figure out how you're doing. If you don't feel brave about filling it out yourself, feel free to just jot your answers down on a scratch sheet of paper. This is more to just kind of give you a sense of what it would feel like to take this survey. So the questions are, in the last 2 weeks, which for each of these statements, think about how you've been feeling over the last 2 weeks, and then say how often you have these feelings. So how often have you felt cheerful and in good spirits? How often have you felt calm and relaxed? How often have you felt active and vigorous? How often have you woke up feeling fresh and rested? And how often has your daily life been filled with things that interest you? Aw, thanks everybody for filling this out. I think this was Crystal's idea, by the way. She was like, we should just have everybody fill out the WHO-5. And I think it's a
Yeah.
great idea. We sometimes think about measurement tools without actually trying them out. So I think it's a pretty cool idea.
Yeah. And I was telling Ginger that something I'm currently working on is how to answer the question, how are you doing, more authentically. Um, so I can never, it's not going very well. Not like my health, but like trying to figure out what are more specifics that I can say other than fine, good. So writing this survey out made me think oh my God, this is actually a way that I can kind of determine how I'm doing, and also maybe say um, I am doing great because I have been very calm and relaxed lately. I have been pretty active, been walking all over the place. So it gives people more insight into me, builds stronger relationships, and um, yeah, helps me answer the question more authentically.
Aw, thanks, Crystal. Yeah, and someone wrote in the chat that they love how strength focused this is. And yeah, us too. Every time I look at the questions, I'm like, yes, this is so about like, how are you doing? Not like, how are you not doing well? It's more about like, how are things going? Okay, I'm going to go ahead and end the poll. Thanks everybody for participating and trying that out. And I won't share the results, but we did, just to be fair, like most of you guys felt brave and filled out the poll, I will say, which is pretty impressive. So I think that's the other thing we really like about the Who Five is you could answer those questions and you're not like, there's not a lot of stigma attached to it one way or the other. You're not like acknowledging you have something wrong with you. You're just talking about how you're doing. So thank you for completing that. Kind of as as we were talking about this sort of little Elmo thing going on in the news, at the end of this, I think they've had Elmo on like the morning network news talking about how to respond to some of the people who answered Elmo's questions, saying how much they were struggling. And I thought this was just really sweet. And actually, the National Council for Mental Wellbeing posted a video of Elmo talking about, how he's so glad that people answered him and that
Yeah.
it was really good to figure out that it's important to ask people how they're doing. And yeah, and there was also a lot of course, analysis of this that like, what does it mean that people like sort of trusted Elmo to answer this
Mm,
question? And Crystal and I were thinking about like, how do we as organizations become the kind of places where people would feel like we're like Elmo, like we're just
yeah.
asking how they're doing. So
Be a figure where when people enter the space or interact with people in the space that they feel automatically um safe, because like what is safe? So I can't think of another word, but like feel comfortable enough to actually share their true responses.
yeah, I think that's so cool. So thinking about this compared to what we currently do for outcome measures, um, I'm curious in the chat if people felt brave about sharing, what are the things you look at now for outcome measures? And my guess is that, and based on our experience, a lot of folks are using the PHQ-9, the GAD-7, measures of abstinence or sobriety, measures of social determinants of health, like housing status, legal status, um, maybe some demographic data around, poverty level. Like, one of the things we thought about as we started developing our sort of strategy for how to help organizations become start using data that is more related to the people that they serve. We thought about all of these measures, but we kind of recognize that a lot of these are really based on, requirements that people have for grants they've received, or HEDIS measures that were really developed for healthcare settings, or they're kind of indirectly measuring the effects of something instead of just asking a person how they're doing. And so that was sort of a gap we felt like we recognized in our field. And so I don't know, I'd be curious if other folks feel like these measures are capturing what you wish you could capture about how folks are doing, or if you also notice that there's a gap. Um, we talk a lot about this idea of people's needs around data and reporting and analysis, basically information. We talk about that a little bit related to sort of like a Maslow's hierarchy of needs. And if you've come to one of our presentations, we always say that we always remind everyone that Maslow got most of his ideas from the Blackfoot Nation, slash stole probably some of those ideas from the Blackfoot Nation, and also kind of misunderstood some of the principles they followed. So while we think of like a traditional Maslow's hierarchy of being basic needs, first you got to meet your basic needs before you can work on like safety. And then you got to have safety before you can work on belonging and, kind of move up this pyramid. In the Blackfoot culture, it was actually more common that people's basic needs were met. And so they could work on how they contributed the best of themselves in sort of a self-actualizing way, but not so much for their own individual like success. It was really more about how they could be a part of a community. So how they contributed to the community doing better. So this idea that you take care of people because you want to live in a world where people get taken care of so you can have the kind of community you want to live in. And I feel like that's kind of the heart of community services. I actually was just talking today to a small agency in a rural place in the United States. And they were talking about how hard it was to stay in business and how they struggled recently. And, they felt like they were constantly putting out fires. And I asked them, like, well, why do you keep doing this? Like, why are you still here? And they said, well, we're from this town. We care about the people here. We want them to have the services that they need. And I suspect most of the people on this call would say something similar. Like, we're here for a reason because we care about the folks we serve and we care about the community we want to create. So, you know, it's hard though, because there's so much you have to do in those bottom layers that it's hard to get past them and move on to something that might really matter to you. So these are just a few of the things I think contribute to this. I think the last few years have been really rough. People have had some agencies have had like 80% turnover. I mean, what are you supposed to do? You're basically starting a brand new agency every few years. People are dealing with multiple hats they're wearing because they're covering for 5 people that used to do one job. Um, or, they're doing the job of 5 people. I think this is another thing that's really happening is the systems we are trying to operate in are just getting more and more complicated and more rigid and more disconnected from what actually helps people. And but agencies still have to function within those systems somehow. So that knowing that the systems are really kind of broken or really sort of have a lot of problems and have a lot of ingrained disparities and all these kinds of things, like knowing that and also still having to work within those systems, I think is kind of a recipe for being stuck in the weeds a lot and not being able to get your head above water to think about the bigger picture. So you end up, we see a lot of agencies that are spending a lot of time and resources trying to get their basic needs met, trying to survive, and not really having time to think about, is what we're doing making the difference we want it to in the world and helping our clients in the way that we want it to. And so some of the time at Mission Driven Data, we're trying to help you get those basic needs met so that you can work on those other things. But we really recognize that we needed to do something more than just help you with your basic needs. We want to help you with those other needs too. So that's really what we're talking about today. We often also talk about this cycle that agencies are in. It's kind of a change cycle, just like the stages of change our folks we serve are in, where, you're going through all these rapid changes all the time. So you're always in some stage of thinking about the next thing you're going to have to do or making a plan for the next grant you're going to have to write. And you kind of end up in this a little bit of a loop, where you're just working on things a little bit reactively. And I think what that leaves out is sort of maybe the thing in the heart of our work, which kind of is we're sort of circling the mountain instead of climbing the mountain. And so climbing up that mountain would lead to some actual transformational change. And so we want to help. We want to help you get there. That's what we're here for. So what is our why are we doing this? Why are we trying to move, help cattle what is behind our urge to want to transform things a bit, or maybe a lot? And I think my guess is this would speak to other people who are here, which is, maybe a lot of us are realizing that the data we look at every day or that funders look at or grants look at is not really transformational data in the sense that it's not telling us what we need to, it's not giving us information we don't already kind of know. It's not giving us information to use to actually make a drastic change to anything. It sort of serves the existing system in a way that maybe we start to realize is not what we want. Maybe you all out there are feeling that way too, a little bit of well, I track all this data and, some data has really helped us become more sustainable as an organization, which is great. But maybe I thought we were going to look at data that would, help us understand, do the folks who are in one program get better faster than folks in another program? Or, we implemented this new access model. Are the folks who are getting access now having more improvements than the folks who didn't get access? Or We stood up a mobile crisis team. Are people who are served by a mobile crisis team getting better results than people who had to used to come into the office? And we can do things like count the number of services a person received, and we can do these like sort of indirect measures, like, well, maybe if a person's address doesn't change as often, then that means they're more stable in their housing. And I've even proposed that before, because I'm like, well, we can do something with the data we have. But we
Yeah.
all are kind of missing this piece of like just asking people how they're doing. What were you
Yeah.
going to say, Crystal?
No, I'm just like, yeah, go Ginger.
Oh, Crystal. Um, but yeah, I mean, the fun thing is like there's a bunch of you here too with us, because I think we're all feeling this a little bit. There's a little bit of this sense of like, we're realizing what we have isn't really doing what we were hoping it would do. It's not like feeding our dreams of what we want to do in the world as far as helping our clients and our communities. So there's also this realization, I think, especially with other sort of movements that have happened over the last few years, we've recognized that a lot of the metrics we track are like very culturally specific and maybe not translatable across cultures very well. So I think that, or they don't match up with your values and mission. I mean, how many agencies, I mean, now, like if we could just talk about like the CCBHC model and how for years agencies were all measuring everybody's BMI, even though like we kind of know BMI is problematic. And there was a way to say like the client refused, and you could just have said client refused all the time. And then, or wasn't clinically appropriate. You could have kind of gotten around it. Um, and now it's out of the new CCBHC metrics. But I mean, having that feeling that you're tracking some kind of data that like doesn't even line up with what you believe about people is like pretty hard. So I think we're all feeling this sort of like, ugh, this isn't quite what we got into this for. We really want to look at data that would mean something about whether we're helping people, because that's why we're here. So I think that's the urge we're all feeling. I think what's getting in the way is we're required to look at so much data that other people tell us to look at. I mean, everyone's doing the PHQ-9 because everyone requires you to do the PHQ-9. And even if most of the people you serve don't have depression, you're still doing the PHQ-9 for everybody. I'm not saying there's anything we can't blame ourselves. That's like required. People are just
Yeah.
doing what they need to do to survive. But when there's that disconnect, I think it's easy to kind of lose sight of this like mission you had, this like, this thing. And so our strategy that we propose for you to help you with this is to get direct input from the individuals you serve using this Who5, using the Who5 as a text message that goes out to your clients, and that they can just fill out, and that data is collected and gets connected up to their record in their EHR. And so like and it's happening on a regular schedule. So clients just get used to getting a text every Monday night that asks them how they're doing. They get we're not going to call it their Elmo text because that's certainly copyrighted, but
Yeah.
the question of, how are you doing? And then
Yeah.
there's 5 questions that a person fills out. So, Crystal and I have talked a lot about how this really, in a way, shifts our power dynamic a little bit,
Yeah.
like it's not us as the clinician saying how a person is doing. It's like asking a person how they're doing.
Yeah. We'll
What
get
do you want to
into
say?
the other slides.
Yeah. Yeah. We've done um, So basically, we're talking about defining some metrics for ourselves as this community, us all here that are here today. The cool thing is the Who5 is not a metric we made up. It's a internationally validated metric that is very well researched and very valid and very good at tracking lots of things. So, but I think the big piece here is, and this is like a little bit of a challenge for all of us, is like taking a lead in what matters to your agency. So it's a little bit of like, instead of what did people say we should track, it's a little bit of like, no, we care about this and we're going to do this. And I think when we get to this point of transformation, we can get this whole other rich picture of what's going on with the folks we serve. So I've been on, and the whole team has been helping and doing this too. We've been on a little bit of a quest to figure out this missing piece of the data that just isn't really captured anywhere. And this last year, you might have run into us. We've been on the road a lot. I've been out there a lot. And one of the most exciting trips I took was to the Global Mental Health Research Without Borders conference in October. It was at the National Institute for Mental Health. There were researchers from all over the world who came to present the findings of their work related to mental health.
It was free to go to,
It was
just
free.
to add.
Yeah, you all should have come. It was really
Yeah.
great. Yeah, we actually were worried it wasn't a real conference because it was free. So, but I flew out there and showed up, and
It was real.
it was
There
real,
were
and
real people.
there were real people, and from literally countries all over the world. Um, it was such a great experience to be around people who are a lot of people who are from countries that do not have the kind of like professional level of professional resources like we have, right? So countries where there's one psychiatrist for the whole country. They're not people who are out there who are psychiatrists. I think there's so much to learn from from this work, because as agencies are trying to figure out how to navigate the workforce shortage or limited resources, like people are figuring out how to do this stuff in countries where they don't have master programs in social work, where they are trying out all kinds of informal supports, mentoring, peer circles. I mean, very creative models that are very culturally specific in certain countries. Things like having a grandmother sit on a bench who you can go and talk to when you feel sad. And the grandmother benches only work in certain countries, and they know which countries they work in. There's all this research happening, and it means that folks have ways of measuring success or unwanted effects of interventions with really great metrics. So that is where we came up with this idea of using the WHO-5 well-being survey, and doing that as part of what we're calling whole person outcomes. Which you guys have already seen, but the WHO-5 Wellbeing Index is 5 questions. They're easy to answer. They're translated into 30 languages. They've been used in countries all over the world. And the reason that this is such a popular index is that it's very non-diagnostic based. So in some countries, people really do not identify as having a mental health problem because there's actually like historical oppression related to like locking people in prison camps who had mental health problems. You could argue whether that's true here too. But anyway,
You want to go to the next slide?
yeah. What were you? Yeah, go ahead. You explain this one, Crystal.
Oh, okay. Dang, I wasn't ready. I just more of like you're getting so excited that it's like I know they're in the other slides.
I know.
Just so people can have a visual. But yeah, I can go talk about the background. So basically, 1982, the World Health Organization got together and was just like, can we come up with like a standard way to really see how people are doing, which they came up with like 28 questions. And then that kind of like, okay, that's kind of a lot. Like, let's go down to 10. Like, okay, I feel like we can do better. And then they really simplified it down to 5, which really, well, every time they looked at it, they realized they were asking kind of like the same questions every time. And there were themes. So there were themes of like what they were trying to get to, which is how they narrowed it down to just the 5. Like, let's ask direct questions. Let's not overwhelm people. And with those 5 questions, they realized they were able to get the same results, like that they were able to understand the person just as well versus the 28 questions.
Yeah. And they also did a ton of like statistical analysis to figure out what were the 5 questions that would actually tell you the equivalent of those 28 questions. So, so it's a very, those 5 questions seem like pretty like informal, but they were actually highly researched and very much developed with the idea of covering all of the components of psychological well-being, which is pretty amazing. And then, as I mentioned, yes, Crystal's like, you're jumping ahead. But yeah, the WHO-5
Let's give people a visual.
No, it's true. Thank you. Yeah, so the WHO-5 has been translated into 30 languages. It's been used, there's a some great literature reviews where they've analyzed like meta-analyzed all of the research on the WHO5. And there's like hundreds of journal articles about the WHO5 where they've used that as the measure of change. So screening from all the way from screening for depression in nursing homes to looking at the psychometric validity of the screening tool of it in adolescents, psychiatric places, looking at the role of well-being in suicidal behavior, it's also been used in a lot of studies related to what we think a lot about when we think about integrated care. So you know how we always say integrated care is important because mental health is just one part of your overall health. There's a lot of research that shows that people who score higher or better on the well-being index have better health outcomes, and people who score lower have worse health outcomes. This really seems to be a metric that is really good at capturing what is it about maybe having some mental health issues that is contributing to poorer health outcomes, rather than sort of the indirect ways we're trying to get at that, like some combination of depression and anxiety and something is why your diabetes is out of control. Well, it's really like probably these 5 things. Like you're not interested in, if you're having all of these, if you're having issues in these 5 areas, you're not having very good well-being. And if you're having a great time in all these 5 areas, you're having a great time with your well-being. So I really love that about this measure. And of
In
course,
the
go ahead.
Sorry, in the handout, we'll also include the research studies that we just mentioned in here. Like Ginger mentioned earlier, there are so many studies on this one index that they did a whole literature review on all the different research studies that are all validating it in their separate cultures, which was like the most surprising to me when researching it, because there are people that different cultures have different values and just different ways of being. And the fact that all these different countries were able to validate it in their population is wild. So that it's kind of just a way of thinking like, oh, so there is a way to like um to have this shared index, to
Mhm.
have to be able to look across populations, like there's something that we can all relate to.
Yeah. And there was just a question in the chat, has this been used much in the United States? It is being used in the United States, and some of these research studies were in the United States, but I agree. I had never heard of this either until I went to this conference. And it's like it's so weird that we are so disconnected from like the research basis of things that like within our field. I will say now, since I've come back, I've mentioned it to people and occasionally other people have heard of it. But
Mhm.
yeah, I mean, I think we could go on a tangent about like, what does it say about our culture that we're not really that into measuring well-being? We're more
Yeah,
into measuring like symptoms.
yeah.
We could talk about the medical model and, lots of things.
So far, it's mainly being used in higher education, which I feel like checks out because retention in higher education, people are really worried about that, and they're like, "Oh, maybe we should check in like how the students are doing, and maybe if they're good, then we can get our retention numbers back up." So, yeah, it's primarily in the U.S. higher education. That's what, at least that's the research that we've been seeing, and we'll have a speaker coming in soon to talk about their research study, but like that's in the later slides.
Yeah. But I think, yeah, this idea, yeah. Once I saw those questions too, I was like, how have I never heard about this metric? It is really cool and then when I started learning about it, I know that it's shocking to feel like you've been in this field for a long time and you can still find something new out. But I think it's a little bit about the silos we're in, like, so I went to this global mental health research conference and there wasn't a single person I recognized from any of the national mental health community organizations. Like no one was there from the National Council for Mental Wellbeing. There was a person from the National Institute of Mental Health because they helped fund some of those research projects that were being presented. But it was like a whole different world. It was like not the same group of folks that come to our conferences and talk to us about what to do. And not just because these were people from other countries, like something about we have a disconnect between like science and what people are learning about humans
Mhm.
and the community system. So yeah, I couldn't believe there was no one there from the National Council. It was free and it was in Washington, D.C., and their offices are there. I still kind of have feelings about that.
Yeah.
Yeah. Or why wasn't there anyone there from SAMHSA? In fact, I'll just tell one more story. I was in one of the sessions where they were talking about a program that was to train lay people in how to provide support, and how they had developed this training system where it basically taught lay people kind of sort of basic like ethics, like here's how to help someone who's having a hard time, sort of like mental health first aid, right? Like, if
Mhm.
someone's talking to you about their feelings, don't look at your phone. And if someone's talking to you about their feelings, like, make eye contact, and like very
Mhm.
sort of basic things.
Mhm.
And then they had a whole model where they provided supervision to people and did monitoring of folks' behavior. And they were able to prove that this program improved the effectiveness of lay people in supporting people with mental health problems. And then they showed a map of all the places they were using this model. And literally there was a circle on every country but the United States. And
How
I,
embarrassing.
and then I, and then I raised my hand and I said, what about the United, what's wrong with us? What's going on in the United States? And the guy said, I'm still trying to get a meeting with SAMHSA.
That's funny.
It was funny. Anyway, okay. So the WHO-5 is validated across many fields. One of the research projects called it a way of measuring the sum of satisfactions that make life worth living. That one made me feel good. It's not specific to a particular diagnosis. It can measure improvements, not just symptom reduction, and it will also show wanted and unwanted treatment effects. So in the same way that like sometimes people who start on medication feel worse for a while, or someone who is newly in recovery struggles a little bit more, it can actually help you identify folks who are having those kind of problems too. Um, the scoring is really simple. You just add up those totals, and 100 is great well-being and 0 is not great well-being. But this is also stuff that I don't know about most of the metrics we use. Like the average score in the general population on the WHO-5 is 70. So you can look at the population who's coming in for services and see where they are compared to averages, which I don't know that we know what the average score on the PHQ-9 is in the population. A score below 50 is considered a screening indicator for depression, and it's considered just almost, it's like 86% as valid as doing a full PHQ-9. Like it can find almost every case of severe depression, just like the PHQ-9 can, but without specifically asking all those questions about depression. And if you have your score increase by 10 or more, that is considered a clinically significant improvement, which again, I don't think I even know what that would, I mean, I know what counts for a HEDIS measure on the PHQ-9, but a lot of the measures we use don't tell you, like, is this amount of improvement actually mean someone's feeling better?
Mm.
It's also validated for people age 9 and up. So it's like the whole range of ages. So the way we're incorporating this into Janet is that you can have things, it's included in Janet. First of all, there's no extra charge. We will help you get this set up so that it will send a text message to your clients every Monday at 7 o'clock, 7 o'clock local time. Crystal did all the research to figure out when people answer the most surveys, and it's 7 o'clock on Monday nights.
Oh, fun fact about Elmo. So when Elmo first tweeted that, hey, how are you doing? He was actually getting a lot of positive responses on threads, but on Friday, a lot of people were like, happy Friday, and or just like, I'm doing great. And then on Monday, that's when everything kind of like went down. A lot of people on X are sharing like, I'm having a really hard time, to be honest. Like, so if that was interesting that it happened on Monday, like great responses Friday, Monday, not so much. Like maybe people were might be focused too much on the temporary fix of that being the weekend, that they're not truly aware of like how they're actually doing when it's like a new day, new like start to the week. Yeah.
And we're doing this on the same day at the same time so that you will have valid data. So rather than doing this at like various times across times and places and days, we really believe in creating a data set that's going to be something someday. If you had like a data scientist who could look at your data, they would be able to make sense of that data. Um, these are
So,
great questions. Go ahead. Sorry. I'll get to them in a second. What were you going to say, Crystal?
I was just going to answer the questions.
Oh,
But if you want to go over this page, then we can.
yeah, yeah. So just to finish explaining this, so people would get a text message that has a link to a survey. We'll show a little screenshot that's an example. We're rolling this out at first. We propose doing this just for folks who are 18 and over because consent laws are so complicated. And we really, as Crystal said, we like to take action. Like we want to do this and not get stuck on like a bunch of kind of stuff that we can eventually resolve, but we want to like get going. And then we're just going to use the rule that if a person's received a service in the last 2 weeks and they're still open and in a program that you're doing the Who 5 for, we just send out that text message Monday at 7. And we're using Twilio for the text messaging, which is everything follows all the right rules. um, but and of course, like it's just like any text message you would get where you have the option to text stop and you wouldn't get another text message from that number. Yeah, and then the real and the way we're rolling this out, we have we want this to be an outcome measure that is, we want it to be able to connect to your data incredible. So like it would be connected to that client's record. It would not be the same as like an anonymous survey. It's really like specifically asking that person, how are they doing survey. So
Christine
yeah.
had a good question about if they will be alerted if someone has a particularly concerning response. So that is something that we also thought of that would be great if people were alerted. I think it's something that could be customized in your dashboard of like concerning responses.
Mhm. And we're working on a new feature in Janet where you can have custom alerts, and that's part of our intention behind that is to set that up.
Yeah.
So that you could have that. There are particularly low scores do indicate a higher severity of depression, but it's not exactly the same as other metrics where there's like a clear indicator of someone being at risk for suicide. We also plan in the text, I'll go to the next slide actually, because it's sort of a good example of how the text message would look. Because our plan would be to include a little note that says, if you're experiencing a crisis and have your local crisis line listed there or 988, depending on what you prefer. So that's our plan with the text message.
So there's a text message, you follow the link, and this is the link. The link is through Jotform, and lots of questions. Well, I guess let's go let's go
Yeah,
one at a time.
this is great. Okay, so let me go back to the top, make sure I didn't miss one. So what service we're using Twilio, we're using Jotform to capture the responses. We have a HIPAA compliant version of Jotform. We answered the question kind of about alerts. We think that's also important, and we're working on a solution to that. Thank you, Rachel. That's so sweet. Oh, that's interesting. That someone mentioned that when they did the Who 5 and they weren't doing well, then it prompted a PHQ 9. That's a good question. That probably isn't part of our initial rollout, but that's definitely something we're excited to learn from this process of rolling this out. And those are the kinds of things we're excited to learn and continue to think about how we can improve it.
Mhm.
Yes, clients can opt out either by typing stop, or we would help you guys make sure that you are capturing somewhere incredible whether a client has consented or not to
Yeah.
receive text messages. So if you're already doing appointment reminders by text message, then we would use that same feature to check every time to make sure that they had not opted out. Are we able to change the frequency? At this point, we're rolling this out in this frequency for a reason. We really think this is based on research, the best way to do it. We're open to talking about that in the future. This is just kind of like phase one. Phase one is like a very standard way of doing this.
And in research that I have done about text message alerts and just like mental health related um, messages, there was actually having a consistent message actually kind of builds like some comfortability and just regularity of like, cool, every week I'll get this message. And it's almost like the person will know that it's coming, and the person will know that like it's almost just like a nice refresher of like, oh yes, it's time for me to check in with myself. How am I doing? So having a regular schedule is great. And we're also working on language of how to talk to your clients about this, and how to make sure that they are informed of like what does this mean for
Mhm.
them.
Yeah. So part of rolling out this would be that we would give you some materials that you can share with your counselors and front desk staff, some things you could have at the front desk. Eventually, we also would probably have like a little link within the survey that they could click on that's like, what is this?
Mhm.
So, and then like later, we have some cool ideas for also how to improve that. Estimated implementation. Um, so we're ready to go. If agencies are excited to do this, we're ready to get started. And we are really excited for our first round of agencies. We're going to provide a lot of support and help. As I said, it's included in Janet. This is not extra. We want, like, my vision is for like everybody who uses Janet to just do this, because I think it's the missing piece that agencies really need. And I know the folks we work with care a lot about the clients they serve. And I want this information in your hands. So, um, that's a good question. Shweddle was asking about people who use Janet on-prem. So right now, the way this is set up to work would be using our cloud, because of, so there's actually, not to get too much into the weeds, but the way text messages work, there are some rules about not spamming people. And so we want to have a little bit of control over like how many people are getting text messages and whether you're making, some of the SQL that goes behind that. Um, that's another great question, Shweddle. Yes, Twilio does cost a little bit of money per text message. Right now, we're prepared to absorb that, and not charge anyone extra. If at some point people wanted to send out other kinds of text messages that were not part of whole person outcomes, I think we would need to talk. But otherwise, whole person outcomes, part of Janet. That's what we're
Yeah.
doing.
So get in while you can.
Get in while you can. Oh, thanks, Peter. We're excited. Colin is going to put a little there. We actually have a little, if you're excited, now I feel like I'm selling a timeshare, but for real, if you're excited, we have a form you can fill out. Colin is going to put in the chat so that we can get your contact information, because so we're not, Aaron, good question. We're not at this point talking about importing the data into Credible. Instead, it'll be part of the data. It'll be in the same place your Janet database is. So the data from Credible is in Janet, and the data from this would be in that same place. So we can make reports that connect those up, but not trying to get it into Credible at this point. That might be something down the road. Yeah, I'm so glad you guys have questions. I just need to take a minute. Yeah, Shweddle, that's great. We will come up with a solution then for folks that are doing on-prem Janet. So that's something we can talk. It's funny, everybody used to do on-prem Janet, and now most of our Janet users are in the cloud. So, but we can talk about it. If you guys are interested, let's schedule a time. Yeah. So really, for people who are using Janet, except for this one little wrinkle with people who are using Janet on-prem instead of in the cloud, really all that's really takes to get going is scheduling a meeting with us, having one or more programs you want to start with, telling us where you capture consent for text messages, and then we'll get it going. We've got all the pieces in place. We have a team ready to help you. We want to get this going. We're really excited. When I stop and think about what we're doing here, this sounds sort of benign, like, oh, we're just going to send a survey out to people's clients. But I'm not aware of anything that does this exact thing out there. I mean, there is what's called what's it called? Feedback informed treatment, which is the SRS and ORS. And that data is something that's out there and people are using, but often that data doesn't very easily integrate with your electronic health record data. So it's kind of its own standalone data system. So I think that there's a part of me that feels like the very first time we pull this trigger and we have this data, it's like the most anyone has ever known about how the well-being is of the clients who are being served in community mental health. That's just, I know that's a little bit big to say, but I think that's true. I just think that, yeah, this is like the piece that's been missing, and I'm so excited to not have it be missing anymore. Yeah, we're just really excited. Okay, so and then what we'll do is we'll help you start analyzing your data. Crystal, as I mentioned, is our implementation consultant. She's going to be at the table with you, helping you figure out some of these things. I'll be involved too. All the members of our team are really excited to support this process.
Yeah,
And
let's talk
then,
about what's to come.
yeah, so then once we start having, so we'll have this first cohort of people who are going to be using whole person outcomes. We'll probably have some meetings as a group where people can share how they're rolling it out, share best practices, share lessons learned. We'll probably have a webinar in the future where they'll come back and tell everyone about how great it is and get more of you guys to sign up. Crystal is working on sample grant language that agencies can use if you want to use whole person outcomes and you want to use that to help get some funding for some IT infrastructure stuff. We're going to have a guest speaker in April who has conducted research with college students here in the United States using the WHO5. And Colin is going to put the link to join us for that in the chat. Yes, Erin, you'd be able to look at aggregate data or drill down to a client. Yeah. Yep. And that data could be on any of your other dashboards too. It could be on your caseload dashboard. It could show the last WHO5 measure and what the change was over time. Yeah, it's all connected. Yeah, so data and reporting opportunities are really exciting because I think the cool thing about the way we're doing this is that I know sometimes some people do surveys or satisfaction survey kind of things and they're anonymous. So there's no way to know what does the sample of folks who are answering the survey represent your population, right? Like sometimes the only people who fill out satisfaction surveys are folks who are very dissatisfied, or people are very satisfied and you don't find out sort of like the average. So, because everyone who would be using this whole person outcomes would also have all of their data out of their electronic health record, you can very easily see, like, of all the people we texted, how many people are filling out the survey, and is it like a representative sample, or do clients in certain programs feel more comfortable filling it out, or do folks, so we'll be able to understand more about the sample. I think it's also going to be really interesting to see a baseline. Just how are people's WHO5 scores going into this, like just starting off?
Yeah.
I think it would have been really cool if we had had this going like pre-COVID and known throughout the COVID. Like we would have known so much more about how people were doing if we had had this information going. So, oh, Colin, can you fix the form? Sorry about that, Peter. Okay, we'll work on that. Thank you for that, Peter. And then the data opportunities, I mean, so I know that when I get excited, I talk really fast and I cover a lot of information. So what I really want to emphasize is that everyone out there is working really hard and trying their very best to provide good services to the people that are in our communities. And, it's my privilege to run a company where we help you guys do that and help that be more effective. And what I love about this project is that it's a way to really highlight what out there is really helping people and to find those pieces that are going well and help spread that out more broadly. And then, on the agenda, I think I said something like, how does transformation really happen? I don't think that SAMHSA is going to come out with our new way we should measure outcomes that we're all going to love and want to do and feel like really measures what we want. I think the way that we make a change in our system is we start with a good idea that has some research behind it, because I don't want to just make something up out of the blue that, is ingrained with my cultural beliefs and all kinds of things. So I think what we want to do, right, is we want to like come up with a good idea, try it out, see if it works, have some evidence that it's helpful. And then, someday, maybe the next time they revise the CCBHC metrics, someone can be in that room that can say, you know what, how about instead of measuring smoking cessation screening techniques and whether we gave out brochures, or maybe instead of measuring, depression remission at 6 months, why don't we ask people about their well-being and see if people's well-being is improving? And here's a way we can do that. Ta-da! I didn't come up with the WHO5 well-being index. It's, it's out there. Anyone can use it. But I've been looking for a while for something that would really, like, going back to what I was talking about, like the folks I served at the drop-in center in Staten Island, I provided mental health support to them. How would I have known if they were doing better? They still wouldn't have scored great on a lot of measures because like they were living a life where they were on the street and they were sometimes actively using substances and they were exposed to a lot of trauma. But I actually think that sometimes I was able to help them feel a little more calm or feel a little bit more energetic or feel a little bit more well-rested because we figured out that Their nightmares were keeping them awake. So those differences that you make matter too. Um, and I think that this kind of a measure will capture that. I also think it matters that we ask people. We should ask people how they're doing,
Yeah.
right? How are you doing, Crystal?
I am doing, because I'm looking at the survey, I'm doing great, better than I thought I was. I'm things that I'm doing and fulfill my life. I woke up feeling refreshed. I have been out and about, and yeah, so I'm doing pretty good. What
Nice.
about you, Ginger?
Yeah, I'm feeling I woke up excited for the day, even though I didn't sleep much because I was so excited.
Yeah.
And I do have things that interest me in my life. And yeah, so I'm also doing pretty good.
Linda asked in the chat, is the reporting of results dashboards included, or would that be extra included?
Well, we'll have some standard reports that will be part of it, what's included. Like if we need to build something custom for you, that might require a little bit of consulting time. But yeah, um, yeah, I should say that's included because really this is designed to kind of be a layer that comes along with Janet. So if you're not using Janet, this doesn't work as well because we can't connect it to your electronic health record data. We someday want to offer a version of this that would be agnostic of EHR, but for right now, this is just like one part of what Janet offers. So, but if you're interested in Janet, I think that was the slide before. It was like, come and get Janet, because then you'll have all of this too. But that's really not our intention. Our intention really is to, the Who5 is open source. So if you think this is cool, you could go and grab it and start getting it completed by your clients. Like it's out there. We don't own that, which also I love. I don't want to own something like that. I want it to be open source. Um,
And we'll go ahead and email the handout after, which does have a link to the form, which you should now be able to, anyone should be able to fill out. And then the links to the research studies, which all of the research studies that I have found have all been free. So love that, love not gatekeeping research and information. So another great thing about the Who5,
yeah,
it's really spreading information.
yeah,
And a short summary, the handout will include a short summary of what whole person outcomes is. So ideally you can use it to reference, but we can also provide another information handout of like, if you need it to present it to someone else, but we also have this video that you can also share.
yeah, yeah. So we will, yes, so we will get a handout. We're also happy to send out slides. We also recorded today's session. Yeah, I'm gonna go ahead and ask our final questions here. But please keep putting questions in the chat. We are very happy to answer those. Oh boy, let's see. Give me a sec. Everybody hang on 1 second. Just a sec. Okay. Yeah, so you should be seeing a couple final questions here. We would love to know, what are you most excited about whole person outcomes? Which of these things sounds cool or interesting or exciting to you? We know why we're excited, but we would love to know what you're excited about. And then also, which of these events and resources are you most excited about? We mentioned the dashboards and reports, guest speakers, the sample grant language, having an agency cohort, or if there's something else, let us know in the chat.
To
Yes, it can be offered in other languages. That is totally available because it's been translated into 30. I mean, assuming it's one of the 30, otherwise we just have to get it translated. Do you feel the text message consent needs to be specific to receiving the survey? We choose to think that if people have consented to receiving text messages, that is okay. That if you already send text messages for appointment reminders, that we feel fine with that. But if you would feel more comfortable as an agency getting additional consent, that's fine too. Since there's
to
an
add to that,
go ahead. Sorry,
a
Crystal.
part of the rollout of like implementing whole person outcomes is we'll be able to give you materials to share with your clients about what the Q5 is, so that way they also get like informed consent of like what is the survey, what's being done with the survey, why should I take the survey? So yeah.
And I think the more that gets incorporated and clinicians are seeing that, then they can bring it up and say like, hey, how do you feel like you've been doing? And then they can say, oh, I also noticed that like your score on this, the how are you survey, it looked like you were doing a little bit better or a little bit worse, or it looked like maybe your sleep was getting a little worse, or is that getting better? And yes, we do want to explore. And if there's someone who would like to do this with the under 18 population, we are open to doing that. Mostly, we just didn't want to say we know consent laws in every state well enough to say everyone can do that. But if you are in a state where you feel like you're already sending text messages to folks under 18 and you want to do that, we will work with you to do it. That's a great question. Chris asked, is there a time frame in which clients need to respond? The way we're planning to have this work is they would get the text message on Monday nights. We would leave that link active until Sunday night. So like then when they get so after Sunday, if they went to that link and tried to fill it out, it wouldn't work anymore like after midnight on Sunday, but then Monday night they get the new link to the new survey, right? A
And
new
there
version.
will be a reminder text sent out on Wednesday as well to give them an
Thank you. I forgot about
opportunity.
that. Yes. So we
Yeah.
would send a little reminder on Wednesday with a link to the same survey.
And the handout will include all these, actually happen to answer all these questions. So hopefully you'll be able to refer to that if you forget the answer.
Great. Well, thanks everybody for filling out the poll. I'm going to go ahead and it looks like people are very excited about the dashboards and reports, being able to help identify people who are struggling, engaging with clients in a different way, and cultivating holistic data-informed treatment plans. I just wanted to mention again that we have a guest speaker coming in April, Dr. Andrew Downs. He's actually from here in Portland. It was so funny. Crystal was doing all this research and she's like, oh, there's a person in Portland who's used whole person outcomes or used, sorry, the Wellbeing 5, the WHO 5 Wellbeing Index. And I had a nice meeting with Dr. Downs, and they used it as they actually validated. They did an experiment where they surveyed college students and had them fill out a whole bunch of psychometric things like the PHQ-9 and the GAD-7, and also did the WHO 5 and found that the WHO 5 was just as good at identifying students who are struggling as all the other stuff. Like they could have just done the WHO 5 and they would have found that out. Oh, that's a good question, Melody. Whether there's evidence about clinician effectiveness. Is there any evidence that it assesses that kind of metric? Probably. We can do some follow-up research on that and get back
That
to
was
you.
actually on our list to research the fit. You just mentioned
Yeah,
that yesterday.
yeah, we've been thinking about that because it's similar in some ways. What was that research? Oh gosh, what was that research? I'm not sure I still remember what your question is related to, Dawn. I'm sorry.
To the WHO 5 and the University of Portland, I believe.
Oh, okay. Yeah, that was what his research was about, was college students. But what's cool is, Dr. Downs like thought about what measures he wanted to know more about. And he was really trying to help the faculty at University of Portland here in Portland understand which students were struggling. So for him, it was, and he'll talk about this when he comes, but he said the hardest thing with having people understand the WHO 5 is people think it's too good to be true, that it can't possibly be like as effective as it is. Yeah, that was part of his research, was that the WHO 5 was just as good at figuring out. I think it's like at 86% as about like identified severe depression. I think it was I'm not going to get the numbers right, but there's very high reliability. It's very good at finding those same things. But as we said, there'll be a handout with more about the research too. So you'll be able to get that. And if you have specific questions, that's what we're all about, whole person outcomes now. So please reach out and let us know what your questions are, and we'll try to get back to you too.
To add to that, with the comparison with the GAD and the PHQ-9, there was actually a lot of research that validate that. I didn't specifically link it in the research studies because we're not necessarily saying use this instead, because that's not realistic, that's not practical. So if anything, we were linking research of like how specific people were using the WHO 5, not exactly in replacement of.
True, because we know a lot of people still have to use those other measures
Yeah.
for grants and state requirements and things like that. But I do think it's interesting, and it would be a nice thing if we could get these funders to agree not to keep doing that and instead use a metric that is more holistic. Yeah. So just a reminder about joining our community. Yeah, and that I just want to end with like one more story, which is that we've been working on this project for a while and thinking about this. As I mentioned, I went to that conference in October, and since that time, we've really been thinking about how we want this to work and what would be effective and how we can support you all. I was talking about it over the holidays when I was visiting with my family, and I was talking to my two brothers-in-law. One of my brothers-in-law is a pilot for a major airline, and one is a wildland wildfire fighter. So like fights fires out in the middle of nowhere in rural states. And we were talking about how we use data in our different fields. And I was talking about how I was really hoping that doing things like whole person outcomes was going to mean we became the kind of that our field would move in the direction of using data that was really related to the results of our work. Like we know a lot of, we're trying hard to understand like the mechanisms of how things work in our field, and we're getting better at that, but that we're still always, that we have a hard time finding that piece about the results. And so my airline pilot brother-in-law was saying that in the airline industry, like they're very related to results, so they're constantly, like, planes have all these monitoring things that make sure that anything unusual that happens they realize right away, and they're also very non-judgmental. So like if something happens that's unusual in a flight, someone will call the pilot up and say like, hey, we noticed there was this unusual thing, what happened? And if it was something that they can fix with an improvement to some kind of process, they will update the training right away. They'll update the manuals. They'll update any software that needs updating. But it's very non-judgmental. It's not like you did something wrong. It's more like, hey, what's up? This thing happened. And then my brother-in-law, who's a firefighter, said that they have the opposite thing, where in their field, like there's data they have to track, and they track that data. And it's things like, did someone respond to the fire within 7 days, which rang a lot of bells for me because we have a lot of those kind of rules in our field. And he's like, but no one ever checks to see if the fires who got responded to in 7 days got put out faster or used
Mhm.
less resources or burned less of the less space. And so he was saying, and so what I want for our field is to be more like airlines and less like wildfires. So that's what I would like for us, is to be moving in that direction. And I think that's where we're trying to get with that. So anyway, and also it made me feel better about flying, even though there's been all these things, but like they really do have like a data-driven sort of non-judgmental stance. And that, I guess the other reason I brought that up is I think we need to keep that in mind with this too, right? Like what we're trying to find out is how people are doing. We don't know why they're not doing well, and we don't want to use this as like a punishment. And if things aren't going well, we want to be honest about it and figure out what we could do better, right? Like this is kind of a brave thing to do, to find out if the people we serve are getting better or not. And I respect all of you who are considering doing it because it's brave and it's important. And I'm glad we're going to try. So, oh, less like planes, Colin says. Okay. So our mission really is, we believe you all should have access to meaningful, understandable data to support you and your mission. And we want to be a catalyst for change in the community mental health system. So we want to kindle your curiosity and creativity and create more leaders who care about this stuff. And eventually, like today, create a new vocabulary of metrics that really measure the quality and value of community services. So that's why we're here. We're so excited that you all came today. Yeah, I'll stick around for more questions. But thank you all. I mean, I know you're out there caring about people, and I'm excited to support you in any way we can. So you're always welcome to reach out directly to me. Lots of links in the chat, and we'll send those out afterward too, like a link to upcoming events and a link to the form if you're interested, and link to the community. We always send you all the stuff. So yeah, and if there was someone that you wish had been here that wasn't able to be here today, let us know and we'll make sure they get a link to the recording too. So Does anyone have any last questions? Crystal, is there anything I missed?
Hmm. I think we got it.
Yeah.
Um, if if someone else has an idea of how we can better implement this
Yeah.
or things to think about, love to hear it.
Yeah. Yeah. We're very open to ideas. This is our whole idea, is that the more we can bring ideas to the surface, then we can get your all's input, and you guys have some really great ideas too. So
Yeah.
yeah, we're very excited about that. Yeah. Oh, I forgot to ask you what you're most excited about, Crystal. Did I? I think I didn't.
I think I mentioned it. It's just the fact that it's validated across different countries and cultures, and that is wild um to have a different assessment that is not so specific to a culture yet is upheld across cultures, you
Mhm.
know? Like it's just, yeah,
Yeah.
if that made sense.
Oh, that made a lot of sense. Yeah. Yeah. I'm also excited about like how it might feel to be someone who would receive a text message once a week who asks how you're doing, that asks how you're doing. Like that might,
Yeah.
I
It's
think,
that self check-in.
yeah, yeah. It's like a little, almost like a little mindfulness moment. So
Hmm.
yeah.
Yeah.
Well, thanks everybody for being here. I hope to hear from you soon about getting implemented. We are so excited, and yeah, keep doing your good work. And we look forward to talking to you all again soon. So thanks everybody. Okay, bye.